Kia ora koutou, kia ora te whānau.
Kia ora.
Welcome to our webinar. It's great to welcome to the panelists for coming, and of course our whānau who have joined us. Thank you for joining us. I believe this opportunity for you is going to be quite valuable, being an opportunity to ask questions and also hear from our panel of experts. What's happening at the moment as far as COVID, Omicron, and how it relates to us all here on Wharekautere. So, kia ora, Ben, thank you for joining. I was just wondering where you were. I see you're an attendee. So, to the whānau, we will be handing over to Ben to chair this forum. But before we do that, I would actually like to pass over to Hone to do the opening karakia.
Tēnā rā tātou, tō te hiki te mihi ki te ato i runga rawa, ko ia te timatanga te mutunga. Hei anō, ko te karakia i te timatanga o tātou hoi, nau mai ngā hua o te wao, o te ngākina, o te waitai, o te wai Māori. Ngā tāne, ngā rongo, ngā haumia, ngā tangaroa, ngā maru. Ko rangi nui e tūhua nei, ko papatūnaku e takoto ake nei. Tūturu whakamāua kia tīna, haumia hui e...
Taiki. Kia ora.
Kia ora koutou.
Kia ora, Hone, thank you for that. So I think, whānau, I might just hand over to Ben Clark, who is going to chair this forum for us, and I hope you get a lot out of the webinar of us helping you learn a bit more about COVID and on Wharekautere. Ka pai.
Kia ora, Dina. Kia ora koutou. Well, first of all, Dina, can you hear me? Because I've come in through attendees. Apologies, I couldn't find the webinar invite for panelists. So first of all, can you hear me?
Yes, you're coming through clear to me. Thanks, Ben.
Awesome. Okay. I don't know if you can see me, but to introduce myself, ko Chief Te Awa, ko Mamto Te Monga, ko Ngāti Kotamana Te Iwi, ko Ngāti Sutherland Te Hapu, ko Ingarangi Te Whenua, ko Aotearoa Te Tūranga Waiwai, ko Otatahi Te Kāinga, ko Ben Clark Te Kawingoa, no reira, tēnā koutou, tēnā tātou katoa. Yeah, big welcome to everybody from the Chathams that has been able to join us this evening, and it's a real honour to be able to chair and host this session alongside Ngāti Mutunga, Monique Kroon, who is the Deputy Chair of the Trust and also is one of the co-chairs of the Chatham Islands Regional Leadership Group for the COVID Protection Framework. And we have, I think, a distinguished and very skilled and knowledgeable group of panelists here with us this evening. So I'm just going to read through initially who they all are. And then when I go to them in respect of the questions that you've all put forward for them around how we get through together the Omicron surge and whatever the future may hold as best we can for the safety of our whānau, I'll just go to the relevant individual and they can briefly make themselves known to you. Then the format is essentially going to be, we're going to work through in the webinar the key questions that have been asked. I'll go to the main lead representative from mainly our health colleagues. There are probably a couple of questions that might need a bit of help from outside health. And then if anybody else on the panel wishes to add anything to what the lead has had to say, then hopefully they can put their virtual hand up in good Zoom fashion, and I'll be able to notice and move it on to them. If for any reason the connection disappears, which it does now and again. Of course, if I drop out, then colleagues just crack on and cover things off as best you can. So my role in all of this, just for those that are listening in, is I'm my day job is I'm the Regional Commissioner for Te Wauponamu for Arapotama Corrections, but my engagement with the Chathams over the past last couple of years has been as the Regional Public Service Commissioner for Canterbury and the Chatham Islands, and that's really focused on helping central government or making central government agencies more strongly integrated and easier for local government, iwi, hapu and communities to work with, because we're quite a complex group of agencies and sometimes quite hard to navigate. So that's briefly my background. So from Fora Maruhiri, you just heard from Hone Tibble, who's the Whanawara navigator on the island. We have one of our main contributors, I think by the looks of these answers, Dave. We have David Monk, who's the COVID coordinator for Rekohu Wharakori Chathams from the Canterbury District Health Board. We have Bernice Murrah, who is the General Manager for Ashburton and Rural Health Services for the DHB. And Bernie, alongside Monique, is the co-chair for the Chathams Regional Leadership Group, which has really been steering the system response and engaging with Wellington and Canterbury around dealing with Omicron in particular over the past few months. We have Mania Cunningham as the Regional Health Liaison for the South Island from the Ministry of Health. So yeah, great you're on board, Mania. We have Catherine Howden, Clinical Nurse Specialist for Infection Prevention and Disease Control from the CDHB. Dr. Cheryl Brunton, the Canterbury Medical Officer of Health from the CDHB. Dr. Sarah Berger, Nursing Director, CDHB Infection Prevention and Control Service. And Brenda Close, Kaitohu Whakatapuhi, Director of Nursing, Ashburton and Rural Health Services, CDHB. So as you can see, a bit of a stellar lineup, and I'm sure we'll be able to cover off the issues that have been raised as they relate to keeping ourselves safe. So what I'll try and do is share it so that we get through most of the responses to the questions from the panelists in reasonably good time, and that we have time at the end available for attendees to ask any questions. Obviously, there's no such thing as a daft one. If you're thinking it, probably somebody else will be too. So please do take the opportunity to test out any thoughts that you have, or something that you're just a bit uncertain about, because it's too good an opportunity to pass up. We'll try and focus initially on a 1 hour runtime. We do have the Zoom link for longer than that, so we can run over, but just to try and give a bit of structure and for everybody's attention span, and you've all got busy lives to lead. So if there's nothing from a process point of view, I'm just going to fire on into the main points to discuss. So the first one, and for this, Dave Monk, COVID coordinator, I'm going to turn to you if I may. Could you just talk us through generally what provide a bit of an overview of what the preparations for Omicron have been like in relation to Wharakori over the last few months? Dave.
Thank you, Ben, and tēnā koutou katoa, everybody. I guess just by way of added introduction, I'd like to just have it noted that for the last 2 years, I've been working in a managed isolation and quarantine facility environment, where I've worked closely with Cheryl Brunton, Medical Officer of Health, and also with Sarah Berger, who's also the IPNC Director as well. And prior to that, I had some time working on the Chatham Islands as well, back from 2005 through till 2020. So yes, Ben, in answer to the question, there's a few things that have been studied and brought into leading up to the current situation that we're in. One is that there was the development of a resurgence plan that was compiled and put together with Catherine Howden from IPNC and another nurse that came out from the CDHB. And they looked through what currently the Chathams has, what the plan is for COVID in New Zealand, and how we can marry those two up, recognising that the Chathams does have some Chatham-centric requirements. And one of the outcomes from that was that they would elect, or they would have a Chatham's coordinator in the COVID space. And that's kind of where I've stepped into it. And I came into that role just over 2 weeks ago, well, 2 weeks ago, let's say. So from that time, MIQF wrapped up for me and I've stepped into that. So for me, this is a fairly new position, but I'm really excited to be here. I'm really looking forward to the next few months of working with the community and engaging with the community. In terms of overviews,
sorry to butt in, Dave. Just one query from Gail, but I think it's a good reminder to all of us from government around acronyms and try and make sure we spell, because we're great ones for a list of acronyms. So if we try and spell that out and assume zero knowledge, the first, just to clarify for the team, what is IPNC?
Sure. Yes. So IPNC is the infection prevention and control aspect or team within the DHB. So Sarah Berger can put a little bit more context around that. If Sarah, would you like to, or Catherine, would you like to maybe just provide a bit of support around that?
Hello, kia ora, and thank you very much for my invite tonight. So, yeah, I'm the Nursing Director for the Infection Prevention and Control Service. We're a specialty service covering the CDHB, and we, since the COVID response, have expanded our work to many different sectors across the health system and wider. And we're a group of technical experts that have specialised in how infections transmit and how to stop them transmitting, which is everything you can imagine from, depending on transmission, if that's in food, water, blood and body fluids, or the air and respiratory secretions like COVID. Thank you.
Thank you, Sarah. And so working alongside Sarah and our medical officers of health, so they're the public health, they're the public health doctors that we also link in with to get guidance from about how we manage outbreaks or what the best way forward is for the COVID response. So my job is to tie in with both medical officer, infection prevention and control, and also liaise with the GP and the clinic as well. On top of that, as part of the preparation, the last couple of weeks, I've been working to engage with the community. So meeting with Hone and Gail at Ngāti Mutunga, connecting with the Moriori Trust. Also, today we linked in with Kohanga Reo, and the emphasis there is just to try and get some feedback, try and get some information of how the community is finding the information that we're giving out or what we might be missing, and also to forward on newsletters that we submit from the Chatham Islands Health Centre, just to give updated information that is really quite Chatham centric and relevant at the time. So as part of the overview, that's a bit of a nutshell there. I was also Ben hoping just to talk about essentially what happens if somebody becomes positive, and just talk through that process. Is now a good time for me to carry on with that?
Thanks, Dave. We'll just take a question we'll take questions as they come up rather than have too much of a list. So just hold that thought and we'll go to Dina.
Kia ora, Ben. Sorry, I've just been looking at Gail's chat and just encouraging all our whānau who are attending, if there's any questions that pop up as our panel are talking, please feel free to type them so that they can pick up on them and capture them and answer them for you. That was all. Kia ora, Ben. Thank you.
Kia ora, Dina. Yeah, good call. And look, if there's any that we don't get to, we'll make sure that we record what's in there and link back with Gail and Dina and come back to everybody that's in attendance here. So it is worth putting it in there. Yeah, Dave, back to you. Thanks.
Thanks, man. So I thought tonight would be a great opportunity to talk about what to expect if you return a positive RAT result, and what you can expect from the clinic, and what support we can offer up to get you through your period in isolation. So let's assume go home, you do a RAT test because you might be feeling a bit snotty or a bit unwell, and it comes back positive. Well, the thing to do from there is to inform the health clinic. So call 035. If you're home and you're feeling well and you do a test at midnight, you can call them in the morning. So you don't necessarily need to call them straight away. From there, you'll be your contact details will be forwarded on to either myself or one of the nurses, and then we will contact you. We'll call you back, and we're going to be following a framework, and this framework's going to get us to ask you some certain key questions. Those key questions are going to be about what's your health like normally? Do you have any comorbidities? And comorbidities are things like if you have diabetes, or if you have trouble breathing normally and that sort of stuff. Or if you're we'll ask you if you're vaccinated. We will ask you your age. We will also ask you your ethnicity, and all of these questions we then apply to a flowchart, to a framework. That framework leads us to where the health team think that you can self-manage your way through your isolation period, so that you're generally fit and well. You don't have any current health issues, maybe you're fully vaccinated. And so when we get to the end of that sort of framework that we're looking at, if you're a self-management, we'll look into some other things that we can support you with. Make sure you've got plenty of paracetamol. We'll give you some good sound advice about when to contact us if you feel that you're getting sicker. We will also link in and just find out that you've got enough food to get you through the next 7 days. We'll also ask you some questions about who your household contacts are, because household contacts, people who live under the same roof as you, they will also need to isolate. There are some exceptions if you are a critical worker, but we would work through that at the time, okay? So that is somebody who tests positive and is generally pretty fit and healthy, quite well, fully vaccinated, okay? Whilst we're also working through that, we'll come across people who need some more wraparound support. They may need some more health support from the clinic. They may be pretty healthy, but or fit and healthy, but they may have some social support that they need us to engage with them as well. So these people, we take them on board as what we call clinical management. So they're not self-management. We're not saying, hey guys, there's a good chance you're going to get through this and things are going to be, relatively stable for you. Come back to us if you've got any concerns. The clinical management people are those who maybe aren't fully vaccinated, maybe have some underlying health concerns that we just want to keep a closer eye on. And so these people we would be engaging with on a more regular basis. Now, it's a clinical call how we do that. It might be that we get back in touch with you in a couple of days. It might be that we get back in touch with you in a day. It might be that we say, look, we're going to touch back with you tonight and just see how things are going. Those people who require clinical management will have an isolation pack sent out to them. Everybody that's positive gets an isolation pack, a home pack sent out to them, but the people who require a little bit additional support, in that isolation pack, they'll have a little oxygen SAT probe. Is everybody familiar with that? It's a wee little device you put on your finger. It tells us how much oxygen you're getting in, you're breathing. Okay, they're pretty important for us because when we call you and ask how you're going, we're going to ask you to put that oxygen probe on, and that is going to tell us how much oxygen you're getting in, how hard it is for you to breathe. When we do speak to you, we're doing an assessment over the phone. So one thing we've become pretty adept at in the last 2 years working in managed isolation is trying to gauge how people's respiratory function is while we're talking to them. So if we're talking to somebody and they're saying 2 or 3 words and then they have to stop and take a breath, that's going to be a bit of a concern for us. So if we have got a clinical concern for anybody that we're talking to, we'll either then go and see them out at the home, or we'll bring them into the clinic. And in the clinic, thanks to our colleagues at the infection prevention and control side of the DHB, we've set up what we call a red zoned room. So that's a way into the clinic. It doesn't take you through the main areas, just gets you up a ramp into a room. Let's call it the COVID room, and that's where we can have you assessed by a doctor. Okay, so that in a nutshell is the beginning part of the process of if you return a positive result. From then on in, depending if you're self-management or if you're clinical management, we'll just obviously take it one day at a time. The main emphasis is if you've got any concerns at any point, we are on the island, we're available to be contacted, and we'll work through things with you. Back to you, man.
Thanks, Dave. That's great, and gives a good indication of that tiered approach that health have put in place. So it sounds like if you're not particularly ill, that there'll be a more of an onus on self-management, but if conditions worsen, then there is support available at the clinic. What happens if I was on the island and got really poorly, to the extent that you didn't think it would be safe to manage me, or you're worried about me deteriorating further? What would happen then?
Sure. So for anybody who we have concerns about, look, we recognise that the Chathams is quite different to being to having COVID in Christchurch, for example, where there's a hospital down the road, or even say the West Coast, where we can drive somewhere. So we have a low threshold for flagging and for raising anybody who's a clinical risk. We tie in with the medical officers of health. We tie in with infectious diseases, who are consultants there, doctors who are in Christchurch. We link in with them directly. Part of my job is to actually get on the phone and have a chat with those guys if we've got any people who are under clinical management who we have concern about. In terms of flying out somebody who may not be well, yes, in answer to your question, we would do that early, and we would use the medevac process, much the same as we would if someone was sick without COVID, and we'd still look to get them out.
Thank you, and initially to Dave, but if there's any other panel members that want to contribute, just chime in or put your hands up. So if I've gone off island, but my whānau wanted to come with me, or were worried about me going onto the island, going back to New Zealand to be managed in hospital, would I be able to travel with the patient, or would my family be able to travel with me if I became very ill?
That would be, is that something for Catherine or Bernie? Are you guys comfortable to chip in with that one?
Sure, I can start with that process, and Catherine may continue. And my apologies to everybody for being slightly late. I did a bit of a record trip from Ashburton back to Christchurch to connect in. So what would happen is actually the actual air retrieval flight, it's unlikely that somebody would be able to go with that, because that is a clinical retrieval. We need to make sure that the medical staff are on board, and it's very focused in that space. However, absolutely, we'd want to talk with whānau and Dave and the team at the health centre if we need to support people to go back to New Zealand. We'd be talking to them on a case-by-case basis. We'd certainly connect in with our whānau auto support and the support in Christchurch around any accommodation that could be available, and enable people to come back, but not on that air retrieval flight. That's quite a clinical flight. And if we're retrieving somebody in that stage, we really want to make sure the clinical team have the capacity to just focus on that one person at that time.
Thanks a lot, Bernie. Thanks. Just to go back to basics, Dave, there's a lot of information in the media about all sorts of different variants, and we've worked our way through Alpha, Delta, now Omicron, probably some others as well. Could you just give us a rundown of what symptoms we ought to be looking out for, or people ought to be looking out for right now?
Absolutely. So yeah, Omicron is, or COVID is a respiratory illness. So the main symptoms that you want to be keeping check of: runny nose, a blocked nose. You can get a headache, you can get a sore throat, you can have a bit of a cough. As well as those sort of main respiratory symptoms, you can also get body aches, because it is a virus. So it's not uncommon to have none of those respiratory symptoms, but just have a bit of a body ache, a bit of a headache, or even just feel quite fatigued. And what I guess one thing that we've seen working in managed isolation is that with Omicron, often people may get a sore throat, and then a day or two later, they'll start to get body aches, a bit of a headache, and they'll just feel like they want to sleep for a short time, for a day or two. Often well, I'm just talking about what I've seen in the past, but 2 or 3 days after the first symptoms really start to kick in, people are starting to say they feel better. So that's one of the indicators that we have too, is if by day 3 or day 4 after you've had your first symptoms, if you're not starting to feel better, that's a bit of a red flag for us. And in our experience, we'd certainly be escalating that up to the team and getting a collaborative approach from within the DHB as to what's the next step we take with this case, with this patient.
Thanks a lot, Dave. And going back to if you have an individual that's COVID positive, but you've assessed them as being lower risk of physical complications, and you think it's going to be pretty mild and they're going to be managing themselves at home, but it's that there are other whānau in the home. What are some of the tips about how family can both look after their loved one who's ill, but also try and keep themselves safe and limit transmission?
Yes, indeed, that's a very good question, because as I mentioned earlier, anybody who lives under the same roof is then designated as a household contact. For household contacts, it's really important that they continue to look out themselves for any symptoms that they may develop. We do ask that public health guidance is that they do a RAT test on day 3 after the case was identified, whoever's they're living in the house with, and also day 7. On top of the day 3 and the day 7 RAT test, we would ask that if they have any symptoms that develop, they also do another RAT as well. In terms of how, what tips we can give, so somebody becomes a positive case, they live with other people, we that day will get out a home isolation kit to them, to the family. In there will be some alcohol gel, some additional masks, some gowns. We'll also, as part of our conversation when we call the positive case, we'll also identify if any of the household contacts have any comorbidities. So if they normally have some illnesses that they live with anyway. And we'll just, again, as Bernie pointed out, it'll be a case-by-case approach. But the advice we give is that keep some windows open in the house, because we know that COVID, when if we keep windows open, we don't want the person with Omicron just to be what we call viral loading. So no windows open means that all the virus just comes out and sort of just sits around them in the room. Keep some windows open so the air can blow through. That's a tried and tested good thing to do, and we found that when we worked in managed isolation. And also, if you are going to be close, within a couple of meters of somebody with COVID, just make sure you've got a mask on. Yeah, if they're in a different room and you're in a different room to them, I'm more than happy for Sarah Berger to chip in here and give some advice as well. But if you're in different rooms, you can probably take your masks off, as long as you've got the windows open, you've got some good airflow. But if you're going to be close, if somebody needs help, if we've got somebody who requires a little bit of help to get up or get about, you need to get close and they're positive, pop on a mask, pop on a gown.
Thanks, Dave. Dr. Sarah, I know you gave a great input to the accommodation providers linked to the ROG a month or so ago. So anything you want to add?
I think Dave's highlighted that in that home delivery pack, there'll be some different items that you can use to just kind of protect yourselves in a way if you're caring for others in the household. And he's really highlighted how important it is that because COVID is spread through what we call shared air, that the use of, in particular, masks is important. Now, this will be probably reasonably unnatural. You all live in a beautiful island environment, blessed with wonderful maritime breezes, and that is a real plus. Just means that you don't have to have the windows wide open. I know we're slowly going into autumn and cooler weather, but if you can create a small airflow in the house through windows on opposite sides of the building open and create a bit of a cross draft, what this does is it effectively dilutes any air that might have some virus in it when you've breathed it out with that beautiful, lovely fresh air. What the masks do is try and help minimize likelihood of transmission. And we have to think, well, why are we doing that? Some people naturally think, oh, you know what, I just want to get COVID and get it over and done with. And that's perfectly fair and understandable thought or position. It's just a matter of thinking, well, who's in the house? And if we all get sick at once, what's that going to mean? Who's going to be able to look after each other? So these kind of measures are just basically tools to help just slow down that infection transmission. But realistically, you know, we live very close to each other when we live under the same roof, and it's highly likely that that if one person in the house has got it, the others soon will have. I can certainly say here at our hospitals in Canterbury, we have lots and lots of staff isolating at home. Most of them aren't that unwell or are caring for someone in the house with COVID, but basically most people with children at school and teenagers now also have COVID. It's just something that spreads really fast. Yeah, that's all I'll say for now. Thank you.
Thanks, Sarah. I noticed we do have a question in the chat, but I'll come to that a little bit later because I think it relates to a broader question around privacy versus safety around who's infected. But if panelists can have a look at that question from Glenys and think about who might be best placed to answer it. But just to stick with the household isolation and whānau under one roof. So if we had a situation where a whānau member needed to isolate away from the rest of their family, and maybe because there's, well, first of all, under what conditions would that be considered? And secondly, for the Chathams, what have we got in place to help people with alternative isolation if they can't self-isolate safely at home? And Dave, I'll start with you, but I don't know if you're best placed to answer both of the parts of that question, but I'll start with you.
I might answer the first part and then maybe get some support from Bernie if that's possible. So really, if we have a household, we have these facilities called self-isolation and quarantine properties. So if we have in a household if there is somebody who is a household contact that is quite vulnerable, it may have a long history of medical conditions, and we're really trying to keep them separate from somebody in the house that's got COVID. So what would happen there is, as part of our initial health check, initial engagement with the home, we would then identify that there's somebody who does have some concerns, some health issues. I would then take that back to the medical officer of health, to the GP at the clinic, and we would have a conversation about whether we should look at getting this person out into a self-isolation and quarantine facility. So on the island, we have a couple of those, but I do believe there's a bit of work potentially going on in the background. So I might just pass this one over to Bernie. Thank you.
Thank you, Dave. So yes, we do have some opportunities at the moment. We have 3 or 4 areas that we can put individuals into for self-isolation, but of course we want to plan up in case we need a bit more than that. It's been a bit of a balanced conversation about, well, how many at any given time do we think we need? We've been working with our public health team around that, and that's just transitioning at the moment to another part with MB providing that support. So we've been in contact over the last couple of days looking for further options to say, what else could we need? And then some longer term planning about actually how much would we need to manage on island, how much would we need to support people to leave. And the line in New Zealand and the mainland is they provide camper vans. Now we all know that's not an easy fit in the Chatham. So we're looking at how can we do this in the best possible way. Part of the process is, as places are identified, our fantastic team of Catherine Howden and Dr. Sarah Berger, our IPNC colleagues go and check out those places, have a bit of an assessment, connect with Dave to just make sure they meet our quite strict IPNC criteria. But rest assured, we've got some places at the moment and we're looking for more.
Thanks very much, Bernie. Okay, Dave, let's go back to the business of becoming COVID positive or being in a household as a household contact. You mentioned rat testing. I think we'll all become familiar with that name and those kits. If whānau needed more rat tests, how would they go about getting them?
Sure. Actually, I would also like to mention that if you do test positive, you don't need to keep repeating your rat tests. I didn't mention that earlier, but once you're positive with a rat test and you engage with us, don't do any more rat tests for positive cases. So in answer to your question, if whānau need more rat tests, the clinic will be able to get some out and we can get them to them in the same way that we get the home isolation kits out as well. So we do have a supply specifically for that purpose. We certainly don't want people who have run out of rats tests just thinking this, they just kind of carry on as usual. We will get rats out to them. For those people or for houses who don't have a positive case, but have run out of rats tests. Now, bearing in mind, we should all have received in excess of 20 for a house, recognizing that as time goes on, there may be homes that do run out of the rats. It's inevitable. The first port of call there will be Ngāti Mutunga.
Great, and Hone has just put that in the chat to everyone as well. Thanks, Hone. So rat tests can be sourced from Ngāti Mutunga or Wharekori. So thanks, Dave, for that. To go back one step, and we've talked a lot about whānau illness, but we're also seeing around the whole country real impacts on staff, of course, and staff are not immune from getting sick and often have to carry on going to work, particularly if they're in frontline roles. Thinking about our great on-island health team, what will happen if our health leads on island go down with COVID or as a contact?
Sure. Yes, and this is something we're super acutely aware of. What we're doing around this, we have an emergency operations centre in New Zealand. So every day, part of my role as a COVID coordinator is just to update them as to do we have any staff who are currently sick? Do we have any staff who are currently off as household contacts? Or any staff who are positive. And so they are a link, this is through Bernie, they're a link into a vast resource of nursing teams, of doctors. And so there is this hub, if you like, that we can contact, we can get in touch with, and we can try and, aim to roll things out pretty quickly. And I imagine that the case would be that we could get people out pretty much on the next flight. A lot of the MIQF staff who worked in the managed isolation space, they are currently redeployed and they're part of a COVID response team. So we can definitely link into those guys. We have the likes of Ian Ogilvie out there at the moment, who's also come across from MIQF, and he's becoming familiar with the Chatham Islands process, so that if he does go back to New Zealand, he can jump back out at very short notice. Myself, I can even get out. I'm currently in Canterbury at the moment, but I'm available to get back out if there is a surge or a deficit of staffing. On top of that, I just want to point out as well that if staff do get COVID and if they feel well, they're able to do some teleconferencing, tele-checks with patients as well. And the ways we're working to mitigate a lot of staff going down at the moment is that we're ensuring that they, following IPNC infection prevention control processes, that staff are wearing masks in the clinic. When we eat, we are eating outside. We're having rolling meal breaks so that we're not having 6 or 7 staff members all just sitting down, and if one of us was to be positive, we're not kind of all just sharing the same airspace. So we're mitigating the processes to ensure that if somebody does come back positive, it will be a slow burn through the clinic and we can just cater to that.
Thanks, Dave. That's great. So it sounds like that. Well, first you've got a lot of a deep pool of experienced colleagues to draw on, and you're taking precautions to minimise the chances that there's a mass outbreak and a number of people go down all at the same time. Great. I'll move on to talked a lot about the health specific response, but the other part of obviously keeping ourselves safe and addressing basic needs is food supply. So I wondered if you could talk initially, Dave, and then maybe somebody else from the team possibly, on if whānau are self-isolating and can't get out, maybe the whole family's gone down, and they're worried about running or even do run out of food, what would happen in those circumstances?
Thanks, Ben. Thanks to everybody for putting up with my voice. So one of the primary questions we ask when we engage with somebody who's a positive case on day one is, do you think you've got enough food to get you through the next 7 days? If they say no, then we get in touch with Heartlands through the council, and we have spoken to Barbie Joyce. I had a good conversation with her yesterday, and they've got some really good supplies. They can get food parcels out around the island. They can distribute them, or they can give them to us to distribute. And so, yes, stopping short of telling you exactly how much food they've got, I've been told they've got really good supplies, and we're definitely linking in with Heartlands around that process too.
Great, thanks, Dave. And I can add, the Ministry of Social Development are well linked in with food banks and providers such as Heartlands. So I know if we were in trouble, I think we heard from the Ministry of Social Development this morning that they felt confident that they had enough supplies there to deal with up to 5,000 Canterbury cases per day. And at the moment, I think the highest we've gone so far is about 3.5. So we seem to be in a pretty good place from a food store perspective. Linked to food, and this might be, this might be something for our Mayor Monique or someone else other than Dave. Give Dave a chance to give his vocal cords a bit of a break. One of the questions we've got is, we've seen this from around the world, and there were some concerns around supply chain issues. Do we expect COVID to disrupt food supplies to and from Wharekuri? We've already heard that we've got good food supplies now, but if we're thinking longer term, any insights on the supply chain? And maybe I'll go to you, Monique.
Thank you, Ben. At this stage, and I think we have managed very well over the last 2 years of dealing with COVID, we have been able to have continuous supply lines to the island. At times it has been, when supermarkets have been short of supply, that we've been able to get people's, working with the supermarkets and through emergency management, get the supermarkets to provide the supplies that we need when the close-off time is. So at this stage, everything seems to be okay, and I have confidence that our air services and shipping services will be regular and continuing. The only thing we might note is that supermarkets are under stress in New Zealand with staff being unwell, and so you have to order and plan well ahead for your supplies, at least 7 days. So at the moment, I think everyone is okay. And one of the great things about the Chathams, we've got plenty of natural resources, and we've got fish, and we've got plenty of cows and sheep running around. So I think we're pretty okay at this stage. Thanks, Monique.
That's great. Cheers. And just to point out for everyone in the chat bar, we've also had a note from Barbie saying Māori Community Services Food Bank is an opportunity for food support, and will through a self-referral as well. Okay, I think I'll go to you, Bernie, for this next broader question. One of the reasons that many tourists come to the Chathams is that it's beautiful, and the sort of incredible natural resources that you have out there. We did have a hui a few weeks ago that had a number of people from the regional leadership group on it around how visitors and tourists would be managed, because that's obviously a fine balance with tourists being so critical to the economic state of the island. So Bernie, do you want to comment on where we're at with that?
Thanks, Ben. Absolutely, and we fully recognise that our tourists we want to continue and support the economy of the Chathams with that. So we've been doing some work both with the health centre and the planning with public health and our medical officers of health, and with Air Chathams around how many people we think we could manage at any given time with COVID on the island? And what are our opportunities to look at flying people back if we actually had like a whole tourist group as such that were positive? There are some opportunities in that, and we've been investigating that option, that potential. We've spoken with the medical officer of health around having some compensation around that, and knowing that normally people are in isolation, but it's like creating an isolation flight. But we certainly don't need to move everybody the moment a tourist is positive. We want to really encourage, and I know Dave will have talked about this and Sarah's talked about this, really encourage good personal protection, lots of good mask wearing, etc. on the island, so there isn't that spread. But we can absolutely manage those people who, if they did get sick, and then we can look at if that actually starts to compound and get bigger, and that's part of our regular, the connection from Dave, the daily meetings that we're in, and I represent the Chathams in that, and in the weekly meetings with RLD, when do we need to escalate and look at something that would be a bit bigger?
Thanks, Bernie. Yeah, so it's quite a balance and playing it by ear, but I guess in learning to live with Omicron, as we're seeing that the borders are opening that bit more, and we've got the loosening of the traffic light settings and mandates and passes, etc. So yeah, it seems like we're in a better place than we were certainly in December, thinking about that particular challenge. Okay, that's most of the questions that have come through. So I think I'll turn to the questions that have come up from Whānau whilst we've been talking, and Glenys has got a couple and a useful observation. So I'll start with the first one, and I want to, Bernie, if you want to start with this, because this is well, it was today, but around rat testing, but in particular, the knowledge in a small place where most people know each other, such as the Chathams, that someone that you, if you're running a business or St John or police or someone in hospitality, and you have heard through the Kumaravine that someone is positive or has recently been self-isolating and is out of isolation maybe early, or you suspect that they're coming into your store and you have heard that they're COVID positive, can people in those professional capacities, St John Police Hospitality, for example, be told or learn who has tested positive, so you can take steps to keep yourself and your other customers safe?
Thanks, Glenys, for those questions. And it's great to see that you had some connection by the look of things with Ian today. I want to just sort of come back to the core principles of healthcare and about privacy. So we take privacy very importantly in healthcare, and we can't disclose any information about anybody's health status in any given time. So that's even to police, or it's across the board, unless there was some legal position that we needed to be able to do that for their own their safety. So some of you may be aware of, under certain legislation under mental health. So I guess it is really tricky, isn't it? You are part of a community, you want to stay safe, you want to ensure the community is staying safe. So it's not going to be through us declaring that, but certainly one of the conversations, and as people are identified as positive, and Dave may have gone through this a bit earlier, even if you've loaded up it as My COVID app, you will get a phone call or get a text in from people. They'll be connecting back with you, just about reassuring and confirming to you that you're responsible for that isolation time. And maybe if I hand over to Dave with this as well, about some of that conversation that it's about explaining to people why it's really important to stay at home or to stay isolated, as opposed to a punitive or you must, because I think that helps people understand that they don't want to make other people sick. They don't necessarily want to spread this. It's helping them understand why it's so important. Dave, do you have a comment to that?
Yeah, I think also, we've seen the isolation time drop from 14 days to 10 days to now 7 days. And so, as the time has come down, there's certainly an expectation that people will, the time is reduced from what it was originally, so that we just really rely on people doing what is the right thing. For anybody who's a case who does go through the 7-day isolation period, if they still have symptoms, part of a discussion in the early part is that please stay in isolation until your symptoms have resolved for at least 24 hours. Most people's symptoms do resolve before the 7 days, but in some certain circumstances, people will continue to feel unwell. We definitely want to link in with those people, and we would like you to stay in your home and remain isolated until the symptoms have resolved for 24 hours. I think also adding to that is that there are some people who will be household contacts who fall under the critical worker exemption. You know, that's essential that they do their job to a degree as a household contact. So if you hear that somebody is a household contact, but you do see them about, there's a high likelihood that they've been given discretionary ability to go and continue to do that job. And in order for them to do that job, they must do daily RAT tests in the morning, ensure that they keep away from other people, or if they are going into a space where there's someone else, that they wear a very good mask just to capture any droplets or anything they're breathing out. So, yeah.
Thanks, David, Bernie. So it sounds like it is a challenging one, and I've just seen Glenys has responded saying understands the privacy concerns, but needs to be advertised more. So with growing numbers of COVID, she'll go straight to the person. I think it is as community leaders and each other, that tension between individual freedoms and the wider community and the health of the team, that is still critical. And as Dave said, there are exceptions that would lead to people being away from their house when you might expect them to be isolating. So we can't make assumptions. But I think, yeah, we absolutely need to stress the value, as Bernie's saying, of people doing the right thing, sticking to the rules, and just to it reiterates why, certainly in indoor settings, things like masks are still going to be a useful precaution.
Also just add in, Ben, that I expect everybody I engage with out in the community to be COVID positive. And so I take the precautions myself by wearing a mask, by keeping distance, by sanitizing my hands. So whether they are or not, I'm treating everybody the same way, that this person I'm engaging with right now has got COVID. And I think if we default back to that setting ourselves, Cheryl Brunton has said on numerous occasions that it's not a given that we're all going to get COVID. And there are things that we don't know about COVID we're still finding out, like the likes of long COVID. So we can all take steps ourselves at an individual level to ensure that, we try and keep ourselves and our family safe.
Thanks, Dave. No, that's really a critical point. Thank you. Just an observation also, Glenys, and thanks very much for engaging and putting these thoughts out, noting that Whānau had, I remember the husband had moved into Fulton Hogan accommodation, so I guess there are opportunities on the island when push comes to shove. Places may become available, as well as the ones that the health team have organised. I see Dina's hands up, but I'll just note in the chat a message from Monique just flagging the cost of living has increased on the island. We're seeing a real crunch around costs at the moment in New Zealand and probably elsewhere with inflation, fuel. Monique mentions electricity and the freight costs, of course, so that is going to have an impact and is a concern and something that the council is monitoring and checking in regularly with community service providers. Okay, Dina, you've got your hand up.
Kia ora, Ben. I'm just going to go back to one of Glenys's questions, and it might be something that Dave, Bernie, you guys might need to take offline. Her question's sort of a double question. One is a business owner, and so her question's quite valid. But another one is a St. John's ambulance driver who actually provides support to the medical centre. So I think in response to that question, you guys need to take that offline with her. Just to note that down, please.
Thanks, Dana. We'll follow that up, and that's all about who's got access to that clinical record, but we'll certainly take that up. Dave and I will follow that through. Thank you.
Thank you. And whilst other whānau attendees are thinking of any other questions that you want to put to the panel whilst we're here, I wonder, Manaya, because you've got a ministry, an interesting Ministry of Health role, that is relation to Te Wapounamu and the Chathams, if you could just say a bit more about your position and the role that you've got.
Mauri ora tātou. Tēnā koe hone, mō tō karakia, nau te Māori whakatau kei wanganui a tātou. And thanks Ben for facilitating and this hui. Just my role actually was born out of the COVID-19 response with Omicron, and especially after Delta, and the care and community program was set up. And in my role in the care and throughout the DHBs, we have hubs, and each hub has a certain name that relates to their environment, the place they come from. And so I'm in the Canterbury Hauora Coordination Hub, and that's one hub that I work with out of 5 in the South Island, and the Chatham Islands with its healthcare system sits within the Canterbury DHB. And so in my role in the last 4 weeks, I'm more of a steward. I serve the hubs to ensure that they get all the resources and support they need to support whānau that can have a successful and safe isolation. And as we all know, our Chatham Islands is so much more unique to any other region in New Zealand, but doesn't have access to the type of resources mainland New Zealanders do. And we have to ensure that we have systems and processes in place to look after our island and our community there. So each hub area has its own challenges, its own opportunities, but each hub has pretty much a core sense of values. And number one is the hub's there to protect its hospital and to make sure that the hospitals and health systems aren't overwhelmed with people with COVID, and that they can isolate and recover safely in their own homes. And number two, there's a huge equity lens, making sure no matter who you are in the community, that you have the same sort of service provided for you to have a successful and safe isolation. And so they're quite two big principles that we have to work together to get this done, because with COVID, with supporting whānau to isolate and be successful in isolation, we need each other. So that's my role there. And creating events like tonight and these discussions are great. It's really good to listen and make connections and keep our network strong, because each whānau who may get COVID can get quite complex and can get quite serious quickly, and so we need to support each other to make sure the whānau has a successful outcome. That one is that topic's a tough one, when someone may have to take a life flight and leave the island by themselves. That's difficult, and so I kind of have to see my role as if that person comes to anywhere in New Zealand, that I can have support for them when they land and get all the welfare and support they need to ensure they have a successful isolation and they can get back home safely. One thing I love about the Chatham Islands is its whanaungatanga, and I do see it as one of my roles to protect one of those strong values of the island. Kia ora koutou.
Kia ora manaia. No, it's great to hear about that broader whānau will extend it out to New Zealand and the Manaaki, that you'll be able to provide to people, as you say, experiencing that difficult journey and really anxiety provoking for any of us if we're poorly, and especially if we're away from loved ones. So thank you. Sounds a really valuable addition. I haven't seen any other questions come through in the chat, but if anybody on the panel who hasn't spoken and wants to add something relevant to the kaupapa, please put your hand up now. I know we're running short on time, but I think we've got the Zoom link for a wee while longer. So if there's anything else that you think would be useful for people to hear. Something here from Hone to Manaia. In the past, we've had support people on the flights when they aren't deemed COVID positive. Why wouldn't they be allowed to be a support person? So I don't know if Bernie, do you want to start with that one around?
Sure. So I've checked in with our air retrieval team, and the air retrieval team is not always from Christchurch. What happens is when they need an air retrieval, they're going to work across the country to find the fastest flight that can come in and collect our person who needs to be taken back. And my understanding, as with some of the other policies with COVID, they have actually really made a flatline agreement across all of the air retrievals that it's only the patient that's been retrieved at this time. But like anything, I think we always need to make sure that we are following through. Manaia talks about making sure that we've got that real wraparound support for anyone that's needed, for the whānau that's needed there. So whilst and that time, Dave may speak to that a little bit more, that time of that, and I realize, quite a stressful time when we are supporting somebody to be retrieved, that we're making sure that we're gathering all that other support ready so that we're wrapping around quickly anything that needs to follow through.
Yeah, I think you've covered everything off there, actually, Bernie, and yeah.
Okay, thanks a lot, Bernie, Dave. Right. Well, first of all, thanks again to Ngāti Mutunga and Dina and team and all of the panelists for sharing their wisdom. It is great that something like this can be put on for the community. It can feel, certainly has felt over the last four months, never mind the last 2 years, that things have changed incredibly quickly and you've just got your head around one thing and then it goes and changes again. And that's partly because we've never done this before, but I think the work that's gone in, especially over the last few months in partnership, has been really impressive, and hopefully you've had an opportunity to answer some questions you might have had, and also to get some assurance, and if not, and if there's further information you want, that the health team on Ireland, Ngāti Mutunga, our Mayor, Heartlands, and other community leaders on Ireland will be a great place to take any questions, and they can always reach out to any of us to follow up. So yeah, I will go to Dave, because I think he's got his finger up.
If I can just, there was a question there about cases, and if I can just update everybody that there are currently 5 known cases on the island. That's not to say there are other cases we don't know about, and I think this just comes back to, we just have to keep ourselves safe, keep our family safe, stay socially distanced, wear masks that go over our nose and our mouth, sanitize our hands, and yeah, we don't know how many cases are out there. So let's just go back to the basics and look out for each other and ourselves.
Thanks. And look, we'll certainly, there's a couple of points we'll take away, or the team will take away through Bernie in particular. That's the point that's been made about St. John from Glenys, and I think Hone's question around the life flights and support, and whether there is anything anything else that can be done. Okay. Ko tahi anu te kopapa ko te oranga o te iwi, and on that note, Dina, as chair, I shall hand it back to you. Thank you.
Kia ora, Ben, thank you for that. I just pushed out another chat message responding on from Hunis, so that would be another task for the medical team to take up, because it is a good point. Time for our island leaders to think about, we are not a part of the mainland, we are isolated, we are remote, and everyone sort of needs to start thinking outside the box and what is best for us down here and our community. So that's our food for thought for your RLG team. I just wanted to go around and just to be sure, does any other whānau have any more questions that they wish to ask? Or are you happy to forward it on and we can come back to you with responses? Before I close up, and I might just ask Gail to make comment, because obviously she will have plans in place from the office.
I wouldn't mind if the panelists can address them. So is there anything else that
I've just spotted two. I don't know if I couldn't hear them properly, and I'm not sure, Gail, you might have chipped in, but I've just noticed a couple from Tish, and I don't know if this has been answered, but the current vaccination rates, particularly for booster and Tamariki, who's best placed in the DHB to Dave?
Yes, we did have that information yesterday for the RLG, but I don't currently have that available to me now. Unless anybody else that was at the RLG yesterday, it's not changed from yesterday. So apologies there.
We'll sort that out.
Unprepared.
We can get that back through Dina and team. And another one from Tish to everyone: is there anything else that the community can do? Any other advice for community in looking to support itself, Dave?
I think we really rely on getting feedback from the community. You are our most stringent critics, and so part of the whole emphasis of myself and others engaging with the community is to get feedback from you guys in terms of, what can we put out of the newsletters? What are you hearing? You are so well connected in ways that we are not. So I would really encourage, if you've got anything you want to sort of push my way, or if you've got anything that you think, hey, look, this is not already there's a couple of things from this meeting that I'm thinking, next newsletter, then touch base with the clinic. And we will work to try and get out as much bite-sized, information as we can, just so we're all moving down the same track.
Thanks, Dave. Yep, communication, keep the feedback loop going. It will make a difference, does make a difference. Gail.
Kia ora, Ben. I just would like to thank all the attendees for attending and the questions that they've posed. The podcast is being recorded and will be posted up, so there is an opportunity to go through this information and refresh yourself. I'd also like to thank Ben for chairing and the panelists for making the insights available tonight. Kia ora rātou.
Kia ora, Gail. Thank you. I could only just make out what you were saying, sorry, and I think you were giving thanks for everybody in attendance and the contributing and engaging, the panelists, me for chairing, thank you, and then closing out. So I hope I've got that right, but that's what I could hear you say, but the line was pretty bad. Dina, can I go over to you or to Hone to close this out?
Yeah, kia ora, thank you, Ben. So I'll just reiterate a little bit of what we really couldn't hear Gail saying, but thank you to the panelists. Thank you actually to whānau for coming, for raising questions, and keep the questions coming. I believe one of the final questions was, who can you contact if you need more help? There's a wealth of people at the moment that you can contact. It could be the health centre, it could be our Ngāti Missionaries whānau order navigator. There's many contacts. So if you have questions that might not have been answered, please feel free to contact us. I'd also just like to thank you, Glenys, for your acknowledgement of Ngāti Mutinga helping to support and deliver the RAT tests with the area coordinators, as well as the COVID booklets. It's always great to hear positive feedback from our iwi in the community. And in closing, Ben, thank you for chairing. That makes my job easier, just giving you emails to direct. Appreciate that. And panelists for the information. But really, I'd like to thank Gail. So some whānau here would not know that Gail, this is our second webinar, and Gail was approached by one of our community members just saying we need to know more information. And the first webinar we had was around relating to our whānau who have secondary school boarding students and what happens to them if their boarding schools close down. So this being our second one, it's actually worked very well, and really have to acknowledge Gail for basically jumping straight on that to activate the first webinar and now this one, and who knows, there might be more to come. Thank you for that, Gail, and thank you for the work of you and your staff. And on that basis, I'd just like to say thank you to everyone. And Hone, can I please ask you to do our closing karakia?
Tēnā rā tātou. Wa tōta hei ki te mihi ki a koutou i taimai te pōnei. E runga te ipurangi e kōrero te tātou ki a tātou. Te kanuhi ki te kanu i tēnā mai ngā pau a rangi nui. Hei anō pui atu ngā whakaaro tērā o tāhiri mātea. Ki a koe e manaia, he wero tēnā ki a tāua e kōrero. Ko te whakaaro tēnā, ko te tērā tūpapaku e whiri haere ki o tautahi kari e taia mai tuna taha te tamanei. Ko te raru nei, ko te raru tēnā o wharekauri. Hei anō, wai ho tērā me kōrero tēnei wā, ka kōrero tāua, kia koutou a pīnā, tēnā ra koutou. E tātou i rungo rawa tēnei, ki te mihi ki a koe, kua horongo koe, o tātou kōrero, me te pono, me te tika, ko te whakaaro tēnā, huri haere ki te pō, whiu atu ngā hara, me ngā kōrero pēnā, tai mai, hei a pōpō, e whiti ana tarā, ka watea, ko tātou whakaaro, hau pai mārie, kia ora tātou. Kia ora tā.
Kia ora.